and attending. So I'll get Pastor Kim to come up and pray for this time. Yeah.
Let us pray. Father in heaven, we just want to give you thanks and praise you again for this gathering. Lord, we ask that your presence be known and be felt among us. Lord, we seek your face. Lord, even as we come to talk about this important topic of mental health, Lord, you are the one who created us. You are the one who want us to have complete health, not only physically, mentally, but also spiritually. And now, Lord, this afternoon, as we talk about mental health, I pray for your servant, our brother here, Lord, that you will just anoint him, that you grant him a clear message, that as he speak from wisdom from you, and for the rest of us, that we may open our hearts and our minds to hear from you. That, Lord, truly we may seek to glorify your name in all that we do. For we ask and pray this in Jesus' name. Amen.
Thank you, Pastor Kim. So, KG, we work together at MST and Center of Theology and Psychology, which is like a department from MST. So, just tell us a little bit about your background.
Sure.
Yeah.
Is it on? Yeah, it's on. Well, I was born and brought up in Singapore and did all my schooling there. My father always wanted to get back to India when he retired. So when he retired, he went back and settled in India, in a state called Kerala. And interestingly, those who know Kerala or know about Kerala, Christianity came to India, to Kerala, before it went to the West. I don't know how many of you know. St. Thomas, the disciple who came to, So I'm a descendant of one of the, what you call the Syrian Christians. My father went back. So after my schooling, I did my medical education in India. And while I was doing, probably I'll just say the question. While I was doing my medicine, my primary interest at that time was obstetrics and gynecology. I thought it was, amazing to see a newborn child, the miracle of a new birth. And whenever I had the opportunity, I used to be in the maternity ward to see that. But when I was in my internship year, I became very disillusioned with medicine, the way medicine was being practiced. And I was going to kick medicine and go into full-time Christian ministry. And at that time, an Australian missionary doctor who was working in India counseled me and said, no, don't do that, KG. You'll regret it. You can always do Christian ministry, but you might regret leaving medicine at this stage. Do what you can. So at that time, that's when I developed my interest in mental health, because I felt that in mental health, rather than just focusing, as you know, in medicine these days, just on one organ or even part of an organ, you have to look at the whole person as a whole being. You can't forget the physical aspects. You think about the mental, emotional, and as a Christian, I had the opportunity to look at the spiritual things. So that's how I became interested in mental health. Went to UK to do my psychiatry, got married there, 4 young children. At one time, we had 4 under the age of 4. And we felt called to come to India, so we moved to India as missionaries, and we were in India for 10 years. And then God, we never even planned to come to Australia, moved us here in 1995. That's how we ended up here.
Yeah. And also, you've worked for the Victorian government.
Yes, I've always done public service, never worked in the private, always been a public sector psychiatrist. But I was also, for about 10 years, the deputy chief psychiatrist for the state. So I did half-time at Eastern Health and a half-time at the department as a deputy chief psychiatrist. Yes, I did. Yeah.
Tell us one thing perhaps on the mission field in India, one thing that you perhaps learned that was a takeaway for you when you were there.
In the mission field?
Yes.
I've worked mainly with medical students, visiting a lot of medical colleges and mission hospitals and ministering to them. Um, oh, Look, when we're talking about mental health, just to bring it to context, the question that I was asked, even when I started doing psychiatry, I was already a Christian, by Christians, even in UK, and the same thing by medical students very often in India. The first question is, how can you as a Christian be involved in mental health or psychiatry, which is a non-Christian field? Then I had to tell them that mental health or psychiatry was no less Christian than any other field of medicine. So mental health was right at the bottom when you talk about mission work. People's mental health, the priority was so little. And in developing countries, it was even worse than in developed countries like this. So the challenge was there, and that's why I have always felt my desire, and now that I've retired, more of it, that's why with the Center of Theology and Psychology too, the passion is to try and break down the stigma and the lack of understanding about mental health among Christians and in the church. That's my passion.
Thank you, KG. Well, the floor is yours.
Okay, thank you. Now, thank you, Hohen, for inviting me, and Pastor for opening the church. Because it's a small group, we can make it very informal. Now, the whole topic about mental health and the church is a huge topic. And it'll be a full day or 8-hour workshop at least, if I was going to do. So that's going to be now condensed to 1 hour. So you can imagine that's very little that we can do. But I'm happy for you to, we'll have a time of question and answers. And there's a little booklet that I've written because of this whole, again, passion of mine. It's called A Christian Perspective on Mental Illness and Suicide. That's another big topic. Increasingly become to the forefront of us, the suicide. And the suicide rates have gone up after COVID everywhere in the world. And as Christians, what perspective do we have? Do we have a theology about suicide? Is suicide wrong? Is it forgivable? Sin? Is it a sin? Where do we stand? Right? So this is a little booklet. I don't sell. You can have it. There are about 10 copies.
Only available here.
I don't sell whatever I write, so it's available. But if you want to give any contribution for the book, that goes to the Center for Theology and Psychology. Yeah, so you can take that. Now, so when we talk about mental health, what I'm going to do in the little time we have is go through very quickly some aspects about mental health and some of the, again, to do about the stigma, the wrong understanding about the mental health among Christians. And I'm not going to be able to have much time about the Christian response, which is a huge area. But happy to answer questions later as we go along. So let's start. There, I have to point. They're pointing there. It's not working? Yeah, right. So Christians, as I've just said, have traditionally viewed, mental illness and mental practitioners with suspicion. And the stigma is still present in the 21st century, even among pastors and Christian leaders. There's no difficulty. This is a question very often I ask people. There's no difficulty in sharing about physical illnesses and among Christians. For example, I use my personal experience. 2 years ago, exactly, I was diagnosed with a bladder cancer. Now, I have no difficulty telling Christians, anyone, I've got bladder cancer, pray for me, and no problems at all. But if I was suffering from depression or anxiety or schizophrenia or bipolar, how many of us Christians will feel free to share that with a believer in our church or someone in our church family? And the question is, why not? Why can't we share that the same way that we can share about our physical illnesses? What is the problem? Something for you all to think about, yeah? and I would like to know your thoughts as well. So, mental illness is often, I often talk about, in Christianity we find two ends of the spectrum. You'll find people at one end of our Christian faith will say, oh, there's no such thing as mental illness, all to do with your weak faith, or because you have not read the Bible much, or you have not prayed enough. And then the other end, you will have what I call the that's the ultra right-wing Christians. And then you'll find the ultra left-wing, I say, the ultra charismatics who say there's no such thing as mental illness, all due to demon possession. Yeah? Or due to that's the two ends. But we need to be probably look more in the middle. Sorry. Definitions. So when we talk about mental illness and mental health, see the two things there. There is more to, so first of all is mental health. There is more to good health, you can read it, than just a physically healthy body. A healthy person should also have a healthy mind and spirit. A person with a healthy mind should be able to think clearly, should be able to solve the various problems faced in life, should enjoy good relations with family, friends, and colleagues at work, and should feel spiritually at peace and bring happiness to others in the community. That is mental health. Are you with me? Yeah? It's a definition of mental health. So when we talk about mental illness, this is the definition. Mental illness is any illness experienced by a person which affects their emotions, their thoughts, or behavior which is out of keeping with their cultural beliefs. That's very important when we talk about it, because something that I might not believe or I might believe might not be accepted by somebody from another culture. That doesn't make you being mentally ill. Are you with me? Yeah. So that is important. If not, we'll be stigmatizing, saying everybody is about mental illness because they don't believe what I'm believing. So cultural beliefs and personality, out of keeping with their normal personality. All of us have got different personalities. Yeah. And some of us might have more obsessional traits. Others might have more other traits. Yeah, that is normal. But if a person, when you say become mentally ill, then these traits or things have become much more than they normally are. Are you with me? Before you can say it's mental illness, right? And producing a negative effect, that's the other thing. Whatever is happening is producing a negative effect in their lives or the lives of others. Now, so why should we be concerned as Christians with mental illness? Because mental illness can affect all of us, irrespective of age, gender, race, culture, or religion. Secondly, because it's a major public health burden. It is estimated that around 300 million persons are affected by depression alone. Not talking about mental illness. Mental illness, I think the whole thing comes to about 1 billion, okay? People in the world, out of the 8 billion we have in the world at the moment, 1 billion suffer from mental illness of some kind or other. So depression, about 1.5 in Australia, 300 million from anxiety. You can see the figures. I don't want to read it through. You can have a look through all that. And we talk now about dementia, again, among the elderly. So thirdly, this burden is not only in terms of health, but also affects human rights and economy worldwide. Loss of productivity, sickness, absence, unemployment, physical comorbidities, because people with mental illness are much more prone to also suffer from physical illnesses, yeah, comorbidity, and increased hospitalizations, premature deaths, and so on and so on. That's why we should be concerned. Fourthly, is very disabling. Mental disorders are among the 10 leading causes of disability in the world. Fifthly, because it reduces life expectancy by 10 to 20 years. Even in this day with better treatments and illness, medication, a person who suffers from schizophrenia, for example, or bipolar affective disorder has less longevity. They die much earlier, okay? Combination of multiple things. Because mental illness services are inadequate anywhere in the world. mental illness comes right down in the pecking order of medical specialties, the least considered very often and least funded. Because mental illness can be treated. Very many of them can be treated with simple, relatively inexpensive medication compared to very costly medications we use for many of our physical illnesses. Because mental illness leads to stigma, number 8. And number 9, because those suffering are human beings loved by God. Yeah? These are some of the reasons. Now, so what are some of the characteristics of a mental illness? So people with mental illness can have abnormal changes in thinking, feeling, memory, perceptions, and judgments, which are longer lasting, not just, we usually say if somebody's mood is sort of sad or depressed for less than 2 weeks, we do not call that an illness. Okay? So it needs to be a particular duration of time before we say it is a normal reaction to stress or whatever. It's become now an illness. Okay? And changes to the person's behavior. These changes cause distress and suffering to the individual and others. The abnormal changes and distress affect the person's daily life, work, etc. We saw that. Now, when we talk about mental illness, there are 101 different types of mental illness. Very often people think, when we talk about mental illness, all just 1 or 2. There are so many different types, okay, of different mental illnesses. And I'm just breaking it up to simplify for you into what is we call psychotic illnesses. You can see the list there, yeah? And the one that is best known among the psychotic illness is schizophrenia, people talk about, or bipolar affective disorders. But see, there's a whole load of psychotic illnesses. Now, when we say psychotic illnesses or psychosis, what do we mean? These are people whose disease, what we call, are the high impact, right? High impact and low prevalence. What do I mean? High impact, these are the serious mental illnesses, but the numbers might be much less than when we come to the next lot, which we call low impact but high prevalence. So these are the high impact because they are serious mental illnesses. And when we say psychotic illnesses, means they have symptoms which make them have lost touch with reality. Are you with me? So the main symptoms that we all probably have heard of what we call delusions and hallucinations. Have you heard of this? So what are delusions? Delusions are, I'll give you a definition, which, simple definition, 3 criteria needs to be fulfilled before you can say someone is deluded. What are the 3 criteria? First of all, it's a false belief. It's a false belief. Yeah, that's simple. Yeah. Second is important, which cannot be corrected by reasoning. Now, many of us have had false beliefs as we are growing up, haven't we? But the difference is somebody talks to you, somebody brings proof to you, somebody shows you evidence contrary to what you're believing. We are willing to change our beliefs. Yeah? But a person who is deluded, you can spend hours and hours and hours arguing with that person. At the end of the day, they will still say the same thing. And so very often when relatives used to come with the patients, I used to say, if a person was psychotic, I would say, there are 3 things that you need to do when somebody is deluded. What are the 3? And there are 3 A's. One is, do not argue with them. There's no point in arguing. It only causes more distress to the person, to the family. No point, because however much you argue, they're not going to change it. That's why it is called a delusion. Do not argue. Secondly, do not agree with them. Why? If you agree with them, you're reinforcing their false beliefs. You with me? Yeah? And then the third A is, people ask, so what should we do, doctor? You say you don't argue, don't agree. I say, just accept what they are saying. Say, yeah, I understand you're going through this, mom. You feel that somebody, one of your family members is now dementing, and the demented whether grandmother or mother believes that somebody is coming to their house, and they have kept things somewhere. The next day they've forgotten where they have kept it because they're losing their memory. So how best to explain that? That neighbor has never liked me. He's coming and taking this from me. That's a delusion. You can argue till the cows come home, she'll never change that, right? So all you can say is, Mom, I understand how you are feeling, what you're going through, not agreeing or arguing with them. So, false belief, which cannot be corrected by reasoning. What's the third criteria? Which is out of keeping with the person's background, whether it's cultural, social, religious, whatever background, what I said. That's important because let's say you are in a kampong in Malaysia. Some of you are from Malaysia, and somebody, you find a patient comes to you and says, doctor, I've been so depressed recently. My wife has fallen ill. In the recent monsoon, my house has fallen. My children are having problems. And you know what? I tell you, all this is because my neighbor, I had a fight with him a year ago, and he is doing black magic or witchcraft against me. Right? Now, would you say that that person is now psychotic? Maybe, they might be, but you need to check it out. Because in that culture, many people in Malaysia, Indonesia, they do black magic and witchcraft against your enemies. So you can't immediately say it is due to a delusion or false belief. But if you're sitting if I'm sitting in my clinic here and a white Caucasian male comes and says exactly the same thing, I'll think, there's something wrong here. Are you with me? Yeah? That's why the cultural, social, religious background is important before you say somebody is mad or is unwell. Okay? So, psychosis. Delusions, what did I say? The other thing? Hallucinations. What are hallucinations? False perceptions. How many senses do we have? 5. And we can have false sensations in all these 5 areas. Visual, auditory, olfactory, gustatory, we say about taste, tactile. And these are all hallucinations. When you have false, when I see things that are not there, hear things that are not, nobody is there, but you're hearing voices. Okay? Smelling things that are not there. These are hallucinations. These are the 2 main, but there are many other, I'm trying to simplify it, main, what we call psychotic symptoms. And these illnesses that I've listed, at one stage or other, they will and can have psychotic symptoms. Is that clear? Right. Now, again, because of I would have liked to have gone on much more and give you examples, but we don't have. Why is that happening? Neurosis. Neurosis is the next group, what we call the low impact by high prevalence disorders, and they are more of the stress-induced disorders, and many, many, many more people suffer from this. And I'm sure many of you probably have gone through this or know people that have gone through this. Anxiety, generalized anxiety, phobic anxiety, panic disorders, obsessive compulsive, neurotic depression, somatoform disorders, all kinds of stress-induced. Again, we don't have time, but happy to take questions later on. I'm just putting this down. Next, there's a whole load of what we call personality disorders, many different types. I told you about obsessional personality disorders. There are what's called narcissistic personality disorders. There's sociopathic personality disorders. There is schizoid personality disorders. Many different types of personality disorders. And personality disorders are usually due to problems during the developmental stage of a child. Because of their upbringing, background, people begin to have personality disorders. Yeah? Alcohol and drug dependence, huge problem. Huge problem. Increasing problem. Eating disorders, like you have all heard of anorexia nervosa, bulimia nervosa. Among young people, again, after the COVID, the numbers have increased, I hear. Sexual deviation and disorders. Now, these days, we have to be very careful. In the past, we used to say homosexuality was a sexual disorder and have treatment, transgenderism was a, but now society has changed, yeah? But there are still all kinds of sexual deviations and disorders. Now, intellectual disability, with or without coexisting. So people with intellectual disability can have psychiatric disorders, many of them do, and that's what's called a dual disability. Or mental disorders of children and adolescents, another huge group of illnesses, yeah? So these are all, I'm just giving you, again, a taste of all the different, I'm just saying there are so many different kinds of mental illnesses. Any questions so far? Yes? What is that? Narcissistic personality disorder, yes. Yeah, where people who yeah, I'm sure you've heard of the term narcissist, where they feel that they're the center of the world and they are important and make themselves, the way they talk, the way they behave is all to bring attention to themselves in many ways. And probably a good example, I might get attacked after that, is ex-President Trump. Right? I think I feel he's got a narcissistic personality disorder. Probably not. Self-loathing could be there, but it's not, a primary. Okay, so that's, while sociopathic is people who don't care about others, who do all kinds of things to harm others, and those are sociopathic because, they... Personality disorders, yes. They have personality disorders. Many personality disorder people can also have other psychiatric problems on top of that as well. Yes, sure. If it is beginning to affect them or affect other people that they live with, then it is a disorder. I say we all have traits. Many of us might have narcissistic traits, but that doesn't make it a disorder. But when it comes to the point where these traits are beginning to affect our normal life and functioning and also affecting other people, then we say it's a disorder that they need treatment for. Right? Yes? Good question. How much time do we have? So, depression, so many people go through depression. Unfortunately, there's so much of confusion about depression. And one of the reasons is because the term depression, the same term, is used for emotion, right? We often say, I am feeling sad or I'm feeling depressed. That is depression. The same term is used for a symptom of an illness in psychiatry, depressive symptom, which can be there in many illnesses. And the same term is used for an illness, depressive illness. And this has caused a lot of confusion, yeah? When somebody is saying, I'm depressed, are we talking about an illness? Are we talking about just the way I'm feeling now? Or am I talking about a symptom of an illness? Yeah? Now, why have I broken it up? So, people who suffer from what we call I'm going to use another term called melancholic depression, is where they have symptoms which mean they have symptoms which are affecting even their bodily functions. Yeah? They have very often loss of appetite with loss of weight. They have what we call sleep disturbance, especially what we call early morning wakening. Many people have sleep disturbances, but that doesn't mean, so this is classical of the melancholic depression. They go to sleep, they wake up at 2 o'clock, 3 o'clock, can't go back to sleep again, right? They have what we call diurnal variation of mood. They're usually better off in the morning, but as the day progresses, they get a bit better. And then they have what's called either psychomotor agitation, they can't sit still, or they're so psychomotor retarded. You talk to them, you ask a question, no answer, until you begin to ask another question, comes the answer for the last question. Yeah? And they can have, that's psychotic symptoms. They can have delusions and hallucinations. And that's when we say it's a psychotic depression. When they begin to have psychotic symptoms in their depression, we call it psychotic symptoms. But when I said about, in the other classification, neurotic disorders, these are usually stress-induced depression, and they don't have the same degree of symptoms that I was mentioning in the melancholic depression. Okay? And they don't have psychotic. Once they begin to have psychotic symptoms, like delusions, I will say, then it is psychotic depression. And when it comes to treatment as well, we'll see the treatments differ depending on what type of. Okay, so quickly, why do we have mental illness? When we talk about mental illness, the term is etiology or the causation of mental illness, we say that mental illness doesn't have a single cause. Unlike, for example, if you have you've got flu. Why is that? Because of a virus, small little fella who's causing all this problem. Yeah, but and so that is the reason. Well, when it comes to mental illness, we call it multifactorial, not a single cause when it comes to mental illness. So the term that we use is multifactorial. And what are these multifactorial things that we talk about? Genetic or hereditary. Now, not all, but many mental illnesses have a genetic basis. For example, schizophrenia or bipolar affective disorder. There's no doubt that there is what's called a genetic loading. But we don't have to be surprised about that, because most of the illnesses these days, whether it be diabetes, cardiac problems, or whatever, high blood pressure, we are left as human beings the effect of genes from our parents. But that doesn't mean if you've got a genetic loading towards diabetes, we are going to end up with diabetes. Will we? But if we then do not take care about our diet, our exercise, we might be tripped into diabetes. Similarly, we might have a genetic loading towards, let's say, schizophrenia, but that doesn't mean that you're going to have schizophrenia. But along with that, then psychological factors. When we are bringing up pressures, stresses that have been there, social factors, biological factors, disturbances in the biochemistry of the brain. So we used to call it, this is the term that we use, biopsychosocial. And then about 10 years ago, another term was introduced, lifestyle. So when it comes to mental illness, it's BPSL, biopsychosocial and lifestyle factors which contribute to the mental illness. And as Christians, we can also add, it is also important, spiritual factors are one of the factors which could be involved. Yeah? So multifactorial. And the role of stress in mental disorders is very important. All of us are different, the way that we cope with stress. You know, one person with, I give you the example of, we all know these days, have heard of PTSD, yeah? Post-traumatic stress disorder. Example, two soldiers go to war, they see exactly the same trauma, they've gone through the same experience, one comes back with PTSD, the other one doesn't. Why is that? They've gone through the same experience. Because we are all different the way that we deal with stress. Yeah? Remember that. There's a lot of difference. So the vulnerability factor to stress and response to stress is very different from one individual to another. Now, so when it comes to treatment, as I say, I'm skimming through all this. I would like to spend a bit more time in the next thing that we are going through. When we come to treatment, we also say, when it comes to psychiatric treatment, unlike for example, a chest infection or we get an infection, our GP prescribes an antibiotic. That's not the case when it comes to psychiatric illnesses. It is, again, all these things that we depend on. Biological treatments, yes. Medication, psychological therapies, all kinds of psychological therapies that are there. Cognitive therapy, psychotherapies of many different types. And biological therapies is not only chemical medication, ECT and brain stimulation therapies are increasingly being used. social therapies, occupational, vocational, recreation, lifestyle therapies, and spiritual therapy, the importance of faith. What has been found from research, research about spiritual things was lacking some years ago, but over the past 20 years, there's been a lot of research done in the area of faith and illness. And majority of the research has been done in the area of mental health. Okay? And what has become clear from all this research is that faith does not prevent a person from suffering from mental illness, but if you have a faith, it helps in the recovery. A person who has faith is able to recover much better than a person who does not have faith. Are you with me? Yeah? So faith is important, especially when we talk about recovery. All right, let's now go on to why do we as Christians have problems when it comes to mental health? And let me spend a few minutes in that. My time is already up, nearly. So, first of all, we have to look at the root cause of illness or disease. So, we all know this from our studies with the Bible. God created man in his image and was perfect. Genesis 1, we read that. He looked at the creation and said, it's good, it's perfect. And humans they, have been created with a spirit, a soul, and a body. And it's, if you read 1 Thessalonians chapter 5, 23, it talks about all these three. So this is the tripartite theology of man. Not everyone believes that. People talk about bipartite theology. But I believe there's this tripartite theology of man. But what happened at the fall? Sin entered the world. And what happened as a result of sin? The spirit of man died. And we all know, I don't want to spend much time about this, we all know that when man sinned, man and woman sinned, there was a separation from God. God still came, as he did every day, the cool of the day, the Garden of Eden, to talk to man and woman, but man and Adam and Eve hid because they could not face God. Yeah? So separation. And then God threw them out of the Garden of Eden and had a cherubim with a flaming sword to keep Adam and Eve from the presence of God. So that's separation. Secondly, the soul of man became diseased. Look at that word, diseased. Yeah? That's where we use this term. What does it mean? The root is lack of ease. Disease is lack of ease. Now, when Adam and Eve sinned, as I said, God still came, but Adam and Eve hid. And when God said, "Where are you, Adam and Eve?" what did they say? We are hiding. Why? We are frightened. So that is the start of fear. Before that, man did not have fear and anxiety. That's the start of fear, which has then affected all of us, right? Because of sin, the soul of man became diseased. The body of man became diseased, we know, and as a result of that, pain entered the world. Women, Eve, you have to bear children with pain. And then man, you have to now toil to make your living. Before that, work was pleasurable. All human beings are susceptible to disease of body, soul, and spirit. Everyone. Just because we are Christian, remember this, we are not immune. God has never said we are immune. What he has promised all along in the word of God is, I will be with you. Right? Even though you walk through the valley of the shadow of death, I will be with you. Never said he will take us away and make us immune from all the troubles and tribulations that are going on. So the next thing that we need to do is the way that we are created, disease in one area of our life affects the others. So if we have physical illnesses, it affects us emotionally. It's simple. When we have a flu, I'm sure most of us have suffered from flu. How do we feel? We've got a virus which has affected us physically, but it affects us emotionally. Do we feel at that time to socialize with people? Visitors come, I can't be bothered. I'd rather be in bed. And do we feel like going to church and worshiping God? No, it affects us spiritually. It affects us mentally, emotionally, in every way. So spiritual or psychological? Psychological problems can present as spiritual problems. Very often, when we are going through psychological problems, it affects the way we think about God, the faith, etc. Because of our severe depression or because of our psychotic thinking, we begin to have different views. So psychological problems can present as spiritual problems and vice versa, right? Spiritual problems can sometimes come across. Many Christians make the mistake of labeling everything as spiritual. And what this does is, when somebody is going through a mental problem or emotional problem, we say it is all due to your faith or lack of faith. It causes guilt and suffering for the person who is going through the psychological problems. Understandably, we must remember there are areas of overlap we have already talked about. The Bible does not make a distinction between physical illness, mental illness, and demon possession. And we can look at many Bible verses. You can have a look at all that. We don't have time. There are several instances of references to insanity in the Bible. Deuteronomy 28:28. It says, if you follow all this to the new nation of Israel, God says in the whole chapter of 28, if you follow my laws and commandments, these are the blessings. And from verse 28, it's interesting, 28:28, one of the curses, if you don't follow me, is insanity. It says in the Bible. Yeah? So there's a mention right from there about insanity. 1 Samuel 21, David is said to be a madman. So that means the concept of insanity, of madness, was known in the Old Testament times, and that's why David, he was feigning, he was acting as though he was mad. So the concept of madness was known. Jeremiah, it talks about, and Hosea, it talks about mad prophets, maniacal prophets who are behaving like manics. And Acts 27, Corinthians, Paul was described as being mad because of his faith and his, the way that he was talking. And Mark, even now, Jesus Christ was labeled as out of his mind by even his own family. So there are mentions. So there can be a confusion sometimes about religious experience and mental illness. Sometimes both may be present. In fact, such people often gravitate. It should be that they gravitate to church because they find this as a community which will care, accept them. And many psychiatrists, I agree, secular psychologists think of spirituality and religiosity can be a precipitating factor for mental illness. This was talked about in the olden days. Oh, he's too spiritual, so he's prone to mental illness or emotional problems. But this has clearly been shown by research as not being true. Yeah? And people these days don't talk very much about that. Even secular psychiatrists and psychologists, they're much more careful about saying that, whatever their faith might be. Now, sin. All disease is ultimately due to original sin. And there are mental, emotional diseases when people say this is all due to sin, there are mental and emotional diseases with a direct relationship to sin. Yes, I agree. Just as there are physical illnesses with direct relationship to sin. Because somebody has committed a sin, they can have emotional problems, just like, as we know, they can have physical. However, there is not a particular relationship between sin and mental illness. And you see the example of Job. And when people his friends, they did the right thing. With the first 4 chapters, they did what we should be doing with people who are going through emotional problems. They came, just sat with him, didn't even say a word, and grieved along with him, all the things that he were going. But then they started doing the wrong thing. Yeah? They started saying, this must be because of this, or because of that you have done wrong, or this. And God rebuked them at the end. This is not the way. And God's rebuke to Job's friend. Yeah. And New Testament, Jesus' statement in John 9:1-3. When somebody said, just due to the father's sin or grandfather's sin. And as I said, we don't have time to read all this. I'm just going through quickly. Mental illness or demonization. This is the other part. The topic has caused difficulties, conflicts, and suffering for many, many, many people over the years. Due to the wrong theology, many have been misdiagnosed and mistreated. There are widely differing views among Christians and much misunderstanding. You know, devil and demons are real. As Christians, as a born-again, Bible-believing Christians, I believe that there is a demon. And devil, though many modern-day Christians who have got liberal theology say, oh, there's no such thing as a devil or evil spirits. And demons caused suffering. There are Bible verses here you can look up if you have time. Demons were objects of worship. Demons had to be stood against. Jesus cast out evil spirits out of people. And mainly in the Synoptic Gospel, John's Gospel does not mention demons at all, but in many of the others, there are mention of demons. Paul does not talk about demons, but about sin. Now, in the Synoptic Gospel, when we talk about demons, there are 6 encounters with demons in the Gospels. First of all, there's a demon-possessed Gerasenes, yeah? And you can read that in Mark, Matthew, and Luke about this man. And when Jesus went on to the opposite side of the lake, to Gennesaret, he saw this man who came from the graveyard, and he behaved like a mentally ill man. His clothes were torn, and he was violent and aggressive. He behaved like a psychotic person. That is the only mention of a person who is demon-possessed behaving like a mentally ill person. All the other mentions are demon-possessed. In Matthew, Luke, it's about a man who was mute. And then a demon-possessed man whose symptoms were blindness and mute. Then you have the example of the Canaanite woman's daughter who had epilepsy, epileptic boy, man in the synagogue. All these people, they had different symptoms and signs. And so very often when people ask me, have you seen people in your practice in psychiatry who are demon-possessed? I say, yeah, maybe over the many years, 40 over years I've practiced, maybe I've come across a couple who have thought there's something else going on here rather than mental illness. But I then turned around and asked them, do you ask that same question to an ENT specialist? Well, demon-possessed man who's mute. Do you ask the same question that you've asked me to an ophthalmologist, a Christian ophthalmologist? Have you come across who is demon-possessed man who is blind? Do you ask the same question of neurologists, Christian neurologists, whether they have come across demon-possessed people, epilepsy? Why is it only you ask that about from psychiatrists and those who are dealing with mentally ill people? We have this wrong theology that demon possession is equated to psychiatric illness or mental illness. But in the Bible, the majority of the people who are demon-possessed examples are people with physical symptoms and signs. Yeah? You get me? Read those verses yourself, and you'll see that. Okay, so I'm not going to go through all that. We need a gift of discernment when we're talking about demonization, and not all of us have that gift or gift of dealing with it. If we don't, then we need to be careful about dealing with it, like in the example in the Bible. Now, the other reason why we have problems is this whole thing called Docetism. Docetism is a heresy in the early church that held that spirit was good, but matter, including flesh, was evil. And to protect Christ's spirituality, they said, Christ only appeared to be human. He really didn't suffer pain. Now, this heresy was knocked by the church in the early years itself as a heresy. But unfortunately, the thinking is still there in many Christians who feel that when it comes to Christ's disciples. Not about Christ, where we feel many Christians have unknowingly developed a spirituality that denies human beings or Christ followers of unpleasant human feelings. Christians should not have unpleasant human feelings. We are human beings. Human beings have emotions. Right? And I'm reading a book currently which says that we need to come to terms with our emotions if we want to know God better. We need to know ourselves better if we want to know God better. Yeah? So all this denial is Docetism, saying that Christ followers, well, whatever has happened in their past, their childhood days, should not have any effect now because we are more than conquerors. No, it will have an effect. It does form our personalities. There are crises that have happened in our life which will have an impact on us. Yeah, we are not superhumans. We are human beings, yeah, with emotions. How many of you have heard of Christians when they're going through grief, father or mother or grandfather? I'm not sad. I rejoice in the fact that my mother is now in heaven. Really? For 50 years, 60 years, your mother has been with you. Now you have had a cut in that relationship. Do you not feel the pain? It's like saying, somebody cuts your hand and says, "Oh, I'm a Christian, I don't feel pain." Blood is pouring. We do. How many of us say, "I don't feel angry"? But Bible doesn't say don't feel angry. It says be angry but sin not. I wish that many more Christians would feel angry about all the ills that are taking place in the world. Yeah? All the persecution that is happening to our Christian brothers and sisters all over the world. Feel angry. It's only when we feel angry we are going to recognize it and be able to do something about it. Don't feel it, we're not going to be sitting back and not doing like many of our Christians in the churches are. Yeah? So let me stop there because then examples from Bible characters, there are many. Elijah, mental breakdown. Job's emotional pain. King David's emotional suffering. Psalms of lament, there are many of them. King Nebuchadnezzar's insanity. Jesus' emotional grief and pain at Gethsemane, etc., etc. And believers struggle too. Here are examples of many believers, well-known believers who have gone through. William Cowper, Charles Spurgeon, Martin Luther, John Calvin, Wesley, C.S. Lewis, people who have gone through emotional problems, depression and pain. Okay? So conclusion, Christians have caused a sense of guilt among many Christians suffering from mental illness. And most of us, confusion comes among Christians is due to ignorance and wrong teaching. Teaching that the message, intentional or not, that Christians do not have serious problems, don't suffer from problems, etc., etc. Misunderstanding suggests that mental illness is God's punishment. Teaching that claims mental illness is evidence of weak faith, etc. We talked about. So don't minimize the severity of mental illness. Don't question the validity of specific diagnosis. Don't question the legitimacy of treatments dispensed by professionals. Don't assume that spiritual remedies alone will be the only problem. Spiritual remedies are important, but that's not the only thing that we need when Christians are suffering. So there's a great scope for Christians in the sphere of mental health. The biggest single factor for success is psychological therapy, is the therapist that's been found. Again and again, there are 101 now different types of therapies that keep coming. But when research is done, it says it's not the therapy that's the most important, or what kind of therapy is a therapist. So that makes the difference. The personality, the relationship is what makes the difference in treatments. And as a Christian, if you believe, and I believe that the Holy Spirit is dwelling in us, in every interaction with another person, the Holy Spirit is interacting, we can have a great influence and impact. Yeah? The Christians pioneered the 19th century reforms regarding the care of the mentally ill. And in a post-Christian world, Christians have great challenges, but at the same time, great opportunities. Now, let me stop there, and because, as I said, we don't have time to go through how we can what we can do. There are slides there. as I said, in this short time, it's very difficult to cover all that. That takes a whole workshop. What we can do as Christians. But if you're interested, the book has got some of those things mentioned, the booklet. Any questions? Yeah.
Yeah, before we go to Q&A, can we give thanks for God for this dear brother? Thank you
thank
for
you.
his heart. And, yeah.
Welcome.
I don't know about you, but did you learn anything? Yeah? So, yeah, open up to Q&A.
Yep. Any questions you have, feel free. You don't even need that. I think we're a small group. Yeah, Mike. Yeah.
So I've wondered around this. What does a mental health, what's the impact on agency? So in terms of where there's individuals suffering from mental illness, maybe emotionally dysregulated or intellectually dysregulated, something, say you're doing things that can cause harm to other people. What degree do we hold responsible in terms of a personal relationship? What does that mean for us in how we engage with those definition of it? So I'm speaking with somebody who's saying to become athletes. Do I treat them as essentially somebody that's suffering assumed suffering mental illness, or do I?
Do you want to, I don't think some people could hear the back there.
So it's, first, it would be dangerous to label them as mental illness. As I said, we are not gone through the training, or we are not specialized in diagnosing. And I think if you have any doubt about the person's mental capacity or mental illness, the first thing is probably to encourage the person to seek help. A diagnosis is usually very important before we then understand how we can help that person. There are many things we can probably do to help, but I think personally, as a lay person, to label a person as being mentally ill, or is it due to his personality or whatever, we need to be careful about that. But if it is certainly affecting, that's one of the criteria, it's impacting the person's life, his ability to work, his relationships, that means something is wrong, and what we can do is to probably, let me say this, we often want to be solution providers. But what we need to do really as Christians, lay people, is to be fellow travelers rather than solution providers. What many people who are going through depression, anxiety, mental illness, what they want are people who can travel with them. Not, that's my problem as well. Not as a medical professional, as a psychiatrist, even at home, because of the positions I've held, director of this and, anytime one of my children or family members or my wife says something, immediately my mind is working what the solution is going to be for this. Yeah? And my children say, Dad, I don't want to hear your solution. I just want you to listen to me. So many people who are going through difficulties and problems, what they need is, what do they say? A fellow traveler, not a solution provider. So I think until the person, as I said, we don't have time to go through some of the things that we can practically probably do as a church and as individual Christians, how we can help. And especially when we talk about those who are very distressed, this one has got about the suicide. How we can probably pick up people who might be suicidal and what we can do and how we can refer people and to help. So in the short time we have, I don't know whether it's possible for me to say, first of all, to diagnose whether this person is having mental illness, and secondly, what we could do. I think the first thing is to make sure, if you have doubts about the person, can we try to encourage the person to seek some help? I think that will be the first and most important thing that you could do. But they are reluctant very often, isn't it? That's, yeah.
Well, I think it is a possibility where I think everyone goes on the spectrum of mental health, where there's personality
Disorders, yeah.
that can cause harm as well. Do we take the view that we just assume
Because we are all, as I said, we've all got probably defects in our personality because of none of us have had perfect parents, perfect upbringing. Can anyone say, my parents were great people, but not perfect. So my wife will say I've got some obsessional personality traits in my, so all of us probably have got defects. Let us not again be that, I would say, unless the person is so severely unwell that they, as I said, they need help, professional help, let us not be there to probably pick on that and judge them, see what we can do to help them. Yeah. Yeah.
In situation, I'm referring to a personal situation.
Some people can't hear you. Some
Okay,
people are hard of
okay,
hearing.
okay. I'm referring to a personal situation, like you know that individual
Yeah.
who used to be bubbly,
Yes.
later on in life has withdrawn.
Right.
You know that there is something wrong.
Something,
I know that every one of us have idiosyncrasies,
Yeah.
you know. But how do we encourage that
person.
individual to seek treatment when they are in denial?
Yeah.
I say, that's nothing wrong with me,
Yeah.
What do we do in that situation?
A big challenge when it comes to mental illness. Yeah, this is one of the biggest challenges compared to someone going through physical illness. Very often, someone who is going through mental illness, we say, especially those who are going through serious mental illness, they lack insight. Yeah, they don't feel there's anything wrong with them. And how can we encourage them, force them? Very difficult. Now, in the state that we are, or in the country we have what's called the Mental Health Act. Yeah? And a Mental Health Act, every state has its own. It's not a national mental health act. Every state, Victoria has said, and has had a recent revision again about the Mental Health Act. So if someone is suffering from a very serious mental illness, which is affecting or which is impacting the person's life or the life of somebody else, then we can get the GP or the mental health team that is there to come and see and treat them compulsorily, even against their will. They can be treated. This is when it comes to that point. If they are so severely unwell and you're worried about their health or the safety of them or somebody else, then we can do that. But otherwise, it is a challenge, not only for you, even doctors, when GPs, when you see a patient and you say, do you need a treatment? They say, no, I don't. It's very difficult. That's one of the great challenges we have. Yeah. So this is why I'm saying very often it is walking with them. And you see, when we accept people as they are, and when the acceptance and we begin to appreciate where they're coming from, that leads to the person beginning to share with you. When trust is developed, because all these things begin to develop trust, and trust then leads to sharing. Yeah? And sharing then leads to many other things that you can probably, at that point, they'll develop the trust in you and they might be willing to listen to you a bit more. So this is where there's no secret solution. It is, as I said again, I'm saying walking with them, that they begin to trust and feel safe in your relationship, they might be better willing to listen to you and me. Yeah.
At a personal level, you are fearful that you may lose a lifelong friendship,
Yeah, yeah.
If that thing doesn't work, like referring that individual
Yeah,
under the mental
that's
health,
why. Yeah, no.
it turns out that, hey, what's happening here?
That's only for serious, very serious, where you feel their life is at risk or somebody else's life is at risk. We have that.
If there isn't any more,
Sorry, can I just ask one more question?
Yeah.
I'm on antidepressant for the last 26 years,
Yeah.
so I suffer depression. One of the slides you say is that recovery has got to do with faith.
With
Faith.
faith. Yeah. Yeah.
So I'm thinking, I believe that God is with me, that He has seen me through this last 26 years. But, from your point of view, how would you say to me that, I'm questioning? Sometimes I do ask, why, God, why do you let me go through this? And I'm still on medication for the last 26 years.
Yeah, so, yeah, again, the two things. I'm talking about research that's been done, which shows that when it comes to faith, faith does not prevent a person from falling ill, but what is shown as people who have faith recover better. But that doesn't mean that individually, again, everyone is different. Just because you are still on an antidepressant, I'll be the last one to say it's because of your lack of faith. Not at all, yeah? Many of us with diabetes, don't we have to have treatment for the rest of our life? Yeah? Some of us will probably need to be on antidepressants for a long time. Just like if a person who's got schizophrenia, they need to have antipsychotics probably for the rest of their life. Okay? We are all different. The illness that we are suffering from, the degree of it is different. So I am in no way saying that you're spiritually condemned. Not at all. Okay? Your faith is definitely helping you, even to be able to function the way you are. Oh, there's a question there. Yeah.
Hang on, Pastor. You better use.
How would you diagnose the character of William Cowper, who, well, of course, he doesn't live, he lived about maybe 200 years ago,
Yeah.
but he was one who tried to commit suicide many times.
Many times, that's right.
And didn't succeed, and yet he was the writer of that hymn that we all sing today.
Yeah.
There's a fountain filled with blood.
That's right. Yeah.
So what?
Yeah, look, that's why I'm giving you the examples. There are many people who have suffered from depression, well-known Christians, depression, suicidal thoughts, anxiety. We are not immune. So here is a person who has gone through the depression, even though there's no question about the commitment of his faith, his Christian thought, but he probably had, I do not know, he probably had very severe melancholic depression that made him having the cycles. People who have got bipolar affective disorders, they can have cycles of mania, cycles of depression. Some who have cycles of depression, not with the mania. And he could have been having that. And that's a time when they become very severely suicidal thoughts as well. But that doesn't mean that at his good time, he was functioning mentally, be able to think and write songs, and yeah. I think that was one.
Was it Tom? You wanted a question? No. Okay. Well,
Just a general question, like the bipolar or the mental illness. Seems some people is minor, some is getting severe.
Major, yeah.
Yeah, like bipolar. Some seems lots of genius is bipolar.
High impact,
Yeah, high
and
impact.
low
yeah.
impact, yeah.
Now the thing that how many people or percentage they needed to be really professional medical treatment like bipolar in the. Do you have any idea or
Yeah,
how is maybe
for example, schizophrenia. Let's talk about schizophrenia. Schizophrenia, this is another interesting thing. Wherever you go in the world, whether it be China or India or Australia or Malaysia or Singapore, about 1% of the population suffer from schizophrenia. Yeah. Right? It's an interesting fact, again,
1%.
which shows that there is the genetic basis where it's important to think about when it comes to that. Bipolar is also about that. Maybe slightly higher, is also about around 1
to
slightly
2, yeah.
higher than percent of bipolar affective disorders. Yeah. But when it comes to anxiety, depression, for example, we now say in Australia probably 1 in 5 people in Australia suffer from anxiety or depression. So it's quite high prevalence, yeah, of, and that's why they're talking more and more about mental illness. They're saying 1 in 5 suffer from some sort of mental illness.
Yeah. But among this 1% or 2% like bipolar,
Yeah.
how many people, how many percentage, I guess much less, they really need to be the professional medical
When
or
it comes to
the
schizophrenia and bipolar and the severe, they need. There is no way around it. They need treatment. No, when it comes to anxiety and some of the neurotic depression, etc., you might be able to get away without, a specialist, psychiatrist being. But when it comes to the severe mental illness, they need psychiatric treatment. If not, they're not going to get better.
Yeah.
Yeah? Unless there's a miracle healing. Just like physical people who are healed from cancer or whatever, God can still do the miraculous. But they still need, otherwise they need. Yeah.
Is it because for schizophrenia and bipolar, because it has something to do with the chemicals in the brain?
Yeah. So that's why I said,
you need to have-
if you look at it, I go back to that. Again, I'm sorry I had to go fairly quickly. When it comes to mental illness like schizophrenia, bipolar, it is multifactorial. Let me take the example of schizophrenia. So there is a genetic loading. No, there is no doubt now. Thousands of studies have been done which shows that there is a genetic loading. But again, when I'm saying genetic loading, as I said, that doesn't mean because I've got a genetic loading, I'm going to end up with schizophrenia. Yeah? So along with that, let's say there have been a lot of studies have been done about the family, environment, atmosphere. There are many things that might have been happening during the childhood, developmental stage, the family dynamics, which if the person has got a gene would trigger them and into the illness. And when that happens, a biological disturbance happens in the brain. Yeah, and that medication is treating that part. Yeah, the biological disturbance that's happening in the brain.
But
so it's genetic, environmental, psychological, biological.
So when it comes to, does it mean that therefore they still need to have kind of like counseling?
So counseling. So when it comes, so many of the the high impact. I showed you the psychotic illnesses. Psychotic illnesses, the mainstay of the treatment will have to be physical treatments, plus psychological treatments, because all psychological treatments are good. Yeah, but when it comes to the low impact, the mainstay should be more psychological treatments, plus minus medication in some people's case. Are you with me? So if it's anxiety or so the mainstay should be psychological, different kinds of psychological treatments.
So that brings me a question: at what point, say if a person feels down, is sad, for no reason he started crying, he can't function well. At which point should he go and see someone?
I would say if it is going on for some time, for example, depression, we say a change in mood which lasts more than 2 weeks, right? You should go and see a GP who will then make the decision.
Yes, sometimes we are a bit on that point. They go and see a GP. The GP refers you to a psychiatrist.
Not necessarily immediately a psychiatrist. He can make the decision. It could be a psychologist. Okay. So in that context, can I just tell you all, at the Center for Theology and Psychology, we now have what is called, we have got a mental health fellowship. Okay, people who are working in the mental health field. We have also produced a directory of mental health, Christian mental health professionals. Okay, so psychiatrists, psychologists, counselors, social workers, etc., who are working in the mental health field. Now, that is available for you to use personally. It is not for distribution or for notice board. And if you look at our resource section, if you have not gone to our CTP website, please go to the website. And in the resource section, it will say, if you need that, for yourself or a friend or somebody in the church, write to me. And I've also made myself available. If you read that sentence, it says, I am available not for consultation, because I don't do any practice, but I'm available for advice. So if you are wondering about yourself, not knowing, should I go and see a psychiatrist? Should I go and see a doctor? Or can I go and see a Christian counselor? Many of these things can be dealt with by Christian counselors. I'm happy to discuss and then say, maybe this, you don't need to go and see a psychiatrist. Maybe a Christian counselor or a psychologist might be more useful. Okay, so that service is available. Yeah.
KG, you said you got to leave now?
No.
Okay,
I'm fine.
so let's continue during afternoon tea and have your individual questions answered. Thank you
Not
a
at
lot
all.
for your time.
Most welcome.
And
That's
I've
fine.
wanted to have this workshop talk for a long, long time, so
Yeah.
I thank you very much.
Thank you. Thank you
Okay,
for
thank you, everyone.
listening. And please go to the CTP
Yes.
website.
There's actually a workshop happening real soon about grief and suffering. So go to the website, register for that. Webinar. So you can look at it at the comfort in your own home.
Yeah, we all
All right.
go through grief and trauma.
Yeah.
So it's,
Yeah, and there's other workshops. We've even got one on children and teenagers. Yeah. So there's plenty there, resources. Okay, thank you.
Thank you.